1,823 federally registered breast cancer clinical trials were actively recruiting patients. On the whole, enduring treatment for breast cancer is easier today than it has ever been, with effective smaller surgeries, less toxic treatments, and reliable drugs that blunt side effects and pain. The breast cancer mortality rate is 35% lower today than it was in 1990, and it's dropping steadily by about 1 to 2% per year. We are curing more patients than ever. And yet, about 1/3 of all women diagnosed with early-stage invasive breast cancer will eventually see their disease recur or become metastatic. Breast cancer still kills some 40,000 American women every year. This sobering statistic is a testament to the cleverness of the disease and its ever-growing list of known variations. The malady we call breast cancer is, in reality, a broad category of diseases, each with its own risk profile and sensitivity to drugs. This relatively recent revelation has birthed an oncological race to tailor treatments, and increasingly diagnoses, to groups and individuals, and apply treatments with greater and greater precision. But scientific progress in breast cancer has been, by any measure, frustratingly slow and incremental. This is not unique to breast cancer. Rather than a straight line toward better and better care, cancer science in general is more like a road up a mountain that's full of switchbacks and blind corners. The story of breast cancer in America is a story of great successes, but also many wrong turns. Things work in the lab and fail in patients. Assumptions about the disease that scientists once held as unassailable facts seem ludicrous in retrospect. Our inability to end the scourge of breast cancer, though, isn't just about the disease's complexity or the slow pace of science. It's also rooted in where our focus has been for the past half-century. It's now clear that, in many senses, we have been having the wrong conversations about breast cancer. Screening mammograms are helpful to some women, but they fail to detect some lethal breast cancers. Sometimes they catch cancers that are not life-threatening, but are treated anyway. Breast cancer awareness is at an all-time high, but despite all the attention, there has been no successful large-scale effort to learn what causes breast cancer, beyond the small percentage of cases tied to hereditary genetic mutations and the identification of risk factors so ubiquitous among American women that they are virtually useless as warnings. Doctors do not know how or precisely why breast cancer spreads, nor do they know how to kill it off once it does. We have spent relatively few research dollars trying to answer these questions. Despite the races, ribbons, and scientific breakthroughs, women are just as confused and frightened as ever. It's also now clear that in addition to failing to cure many breast cancer patients, treatments women relied on and suffered through for generations were needlessly harsh. After decades of aggressive surgery, chemotherapy, and radiation, an approach known as de-escalation is now in vogue, with doctors and scientists studying whether it might be safe for certain women to skip some of these common treatments on the way to good health. Mastectomies, which surgeons once believed could remove the threat of breast cancer at its source, are becoming a last resort for patients. It is now possible to imagine a future in which women with the most aggressive forms of breast cancer might be able to safely avoid surgery altogether. Pharmaceutical companies that make breast cancer drugs are largely focused on a single goal: to replace conventional chemotherapy, a treatment that has been the gold standard for more than 70 years, with targeted and gentler drugs. As a breast cancer patient in 2014 and 2015, I had the old and the new. In addition to chemotherapy, I had a double mastectomy, surgical removal of 22 lymph nodes under my arm, 5 weeks of daily radiation treatment, and a full year of targeted intravenous drug therapy. There was little talk of doing less. At 35, and with no family history of breast cancer, the odds that I would be diagnosed with an aggressive form of the disease that had already spread to my lymph nodes were so long that they barely registered on any chart. Even my doctors were scared. I was shocked to learn the news and terrified of what it could mean, of course.